so this afternoon I'm talking to Kirkpatrick, who's a consultant sonographer within United Lincolnshire Hospitals NHS Trust. So Catherine, can you tell us first of all a little bit about yourself and your role, please?
Yeah, so I am a qualified radiographer with the HCPC, who then specialised in ultrasound, and from there did a little bit more specialising within ultrasound, and I'm the clinical lead now for ultrasound at ULHT, and that involves me having quite a lot of direct patient contact time, purely clinical. And my role primarily is a lot of the complex cases and complex diagnoses within ultrasound, and I do a lot of interventional ultrasound work, so where we guide needles, biopsy needles, fine needles, drains into people for both therapeutic and diagnostic reasons. So that's my role primarily now.
Thank you. So you're a consultant sonographer, and as we know, there aren't many consultant AHPs. They're fairly few and far between. Can you tell us a little bit about how you came to be in this post?
Yeah, it's a long road, and I think that for anybody embarking on this journey, it's really important to prepare that it is a long road and nothing happens overnight. Mm-hmm. One of the things that I learned all along the way is that it takes quite a lot of determination and perseverance, but in the right way, in a friendly way, and raising your profile, being good at what you do, building relationships. And one of the things that I did was build a national relationship. So I emailed our College of Radiographers and asked them for advice, saying this is what I want to do, this is where I want to go, this is how I see my career developing, and how can I do this? And they were amazing, and they sent my email on to other consultant sonographers and trainee consultant sonographers who emailed back, and I was so grateful for their advice, and to realise that everybody was in the same boat. It's the same long road for everybody, and to be that good at what you do and build up that reputation, it shouldn't be easy.
No, absolutely. So you've had a fair amount of support along the way,
yes.
But obviously it sounds like it's been a lot of hard work,
yes.
too.
Yeah.
I know that you do more than just what we would see in your day job at the trust, and you've been involved in a lot of things nationally. But I think there's one development in particular that you're involved in at the moment that we'd like you to tell us about.
Yeah. So excitingly, ultrasound is developing itself as a new profession, and what that means is that the ultimate aim at the moment is to get ultrasound and the term sonographer as a protected title. And so the Health Education England approached the Society and College of Radiographers and the British Medical Ultrasound Society, who I'm a professional officer for, and asked us to get involved in developing ultrasound as a direct entry degree course. And that was in order to look at the regulation side of things, in order that they can be a regulated state registered profession with a protected title. And that is really important for the safety of patients, for the recognition of ultrasound and sonographers, and also the fact that we were looking at the fact that there are quite a lot of shortages of all AHP professions, as we've been discussing recently, and we're no different. We've been on the migrations shortage occupational list for as long as I've been in the job, and we traditionally gain the cream of the crop from radiographers and train them at a high level, postgraduate level in ultrasound, and yet radiography is short. There are a shortage of radiographers, and you're often robbing Peter to pay Paul. And because ultrasound isn't protected, it isn't regulated, that means that perhaps we're opening up our patients to unsafe practices. And so that's why we were involved in making it a profession, and it is has opened my eyes to a lot of things that I didn't know. It's given me so much more experience working at a government level, working with HE in a project group, being led by the British Medical Ultrasound Society, the Society and College of Radiographers, and amongst others, CASE. And it's taken a lot of hard work, and we're getting there. We go to parliamentary time, and hopefully this is the way forward for ultrasound.
Fantastic. What an amazing piece of work to be in for such a developing profession. That's fantastic. Yeah. It's clearly not an easy road to tread. No. What would you say to people, young AHPs coming out into the different professions, about getting involved in something like this? Because sometimes it can feel quite daunting, can't it?
Yeah, it is really quite daunting, and I think that one of the things that I held these people who emailed me back when I first asked for advice in such revere, such awe, and felt, I don't know, on a level quite intimidated by them. And now they're my friends and my colleagues and my peers in these professional groups, and they got there the same way that I did, by perseverance and interest, and completely wanting to do this for my profession. And so we're all in the same boat. So if young people are young stars, young AHPs in whatever profession, the route is the same, in the fact that you need to work hard, and it doesn't come to you. You work at it, and people notice what you're doing if you're good at what you do. So I think that's, no matter what you do in AHP professions, that's the common ground for us all.
Absolutely. And then opportunities do open up for you. Yeah. You still have to put yourself in the position to go for them, but opportunities do arise.
I think you sort of start off smaller. So I was asked to raise my national profile by doing an e-learning for healthcare, authoring a module.
Okay.
And that was one of the things that started me off. So somebody gave me a little bit of helping hand. They were organising that project and said, you know, your interest is head and neck ultrasound. I need somebody to author a head and neck ultrasound for e-learning for healthcare. This is a way of your way in. And it was one of those people that emailed me back that helped me on there, knowing that I was quite interested. But I made that first step. I was the one that sent that email out and said, I want to do this, can you help me do this? And you do need help, and you need guidance, and I still need help and guidance from other people. I talk to you a lot, I sit and listen to how you are in meetings, and I learn so much. So I still get inspired by others as well, so never lose that, no matter how far you go in your career.
Absolutely. And I think it's as well remembering those people that emailed you, made such a difference for you. You're now one of those people.
Yeah.
And it's remembering that when, you know, when the email drops into your inbox from someone needing help, and it's about being able to give that something back as well. That's a real privilege, I think.
It is an
in the professions.
Privilege, and as you say, you never forget that. And now, you know, people before us pushed the boundaries, people now we can push the boundaries. Every generation will push that boundary a little bit further, we'll do a little bit more, we'll open those doors for the people following us. And when I get emails saying, you know, you've done this before, how did you do it, what advice have you got? And it's one of those emails that I never put to the bottom of the queue. And I get an email from Leicester saying, thank you, I've done this, we worked our way up, and thanks for your support. And that means a lot. So it's not just, you know, here in our trust, we can do it for other people, other AHPs, other professions, and we're all working towards common goals.
Absolutely. And as well as all the national stuff, you're obviously heavily involved in the Lincolnshire AHP Strategic Group. You're clearly not at the conference, this year's AHP conference, which is why we're doing this today. Do you want to tell us why, what you're involved in?
Yeah, so Angela Shimada asked me to do this 10-minute presentation or so for the conference, and I, as usual, double booked myself in the calendar, and I'm actually in Swansea teaching at an international course for head and neck ultrasound, so I'm part of the faculty there. And we've got delegates from Canada and Sweden and all over the place that come in, and it's again, this is a wonderful thing to get involved in, because as a consultant sonographer, teaching and clinical work is at the heart of what we do, and that helps you and is absolutely vital for me in my role to bring this back to ULH. So although ULH have been amazing in supporting me in radiology to do these external things, but I bring it back with me and hopefully add so much more to the department from what I'm learning externally, and keeping up to date with practices, what others are doing, sharing good practice, and I think that's essential. So although I do a lot outside of the trust, I hope that I bring the same back in.
Absolutely. So we've come to the end of our time. Is there one last message you want to give for the AHPs out there in Lincolnshire that are aspiring to get involved in something like this?
I think that you need to work hard, you need to persevere, you need to be inspired by what you do and not just inspire others. And I think that once you start on that journey, the idea, I think, is to bring others with you. And one matriarch of radiology said to me when I was a trainee sonographer, and I looked up to her for inspiration, was, you know, you've done your job when the next generation excel the teachers, and when the student excels the teachers, you think, you know, you've done a good job. So bring everybody with you.
Fabulous. Thank you for your time.
Thank you, Anita.